As part of my monitoring visit to the Episcopal Church in Cuba, I participated with other 22 local community leaders in a training on disaster management. This was held in Santiago, Cuba, for 2 weeks in June 2019. I felt fortunate and humble when these wonderful people shared with me stories about their challenges, successes, and hopes. All these 22 trainees began a disaster management committee in their own 22 committees in December 2019. I remember a week after the World Health Organization declared COVID-19 had become a pandemic, I called the Episcopal Church of Cuba to offer our support. I was so impressed to know they had already started a COVID risk reduction plan. From March 9 to March 20, in only 11 days, almost 3,000 copies of information materials on the pandemic were produced and circulated in churches, schools, medical centers, homes, and bus stations. I was quite moved too when I learned that those 22 disaster management committee and their church leaders were visiting the elderly and the sick to offer support and pastoral care. I was very much inspired to know how these committees invested their limited resources, time, and expertise to help those in need during these difficult times. For instance, fabric and thread were donated by each community. With the help of the women from the local church, they were able to produce face masks using their own sewing machines. I am grateful and feel honored working in partnership with the Episcopal Church of Cuba. This fantastic story testifies a true demonstration of their love and commitment to their communities. It is an impressive and inspiring example of building resilience that was effective with the local church and community response to COVID-19. We are united together with our Cuban partner and all the communities there in prayer and solidarity.